present For the Record.
Welcome to For the Record. I'm Naomi Kowles. Tomorrow is a big day in Wisconsin. Everyone 16 and older becomes eligible for the COVID-19 vaccine almost a month sooner than previously announced. Today I'm checking in with major vaccinators in the area about what you need to know ahead of booking your shot, starting with UW Health's Dr. Jeff Pothoff.
Well, good morning. Thank you so much for joining us today. So let's just start. Tomorrow, we're looking at expanded eligibility for vaccinations for everyone 16 and over in the state. So tell me a bit how UW is working to meet that demand.
You know, one of the ways that we're trying to meet this demand is our recent switch in our scheduling system. You know, for a long time, we were using our records to identify people who were eligible for a vaccine, reaching out to them and letting them know that it was time for them to schedule their vaccine. You know, now with so many people eligible and the inability of our records to identify or know whether someone's eligible or not, we've switched to a self-scheduling platform where you can go seek out your vaccine appointment, you know, answer a few questions, fill out that attestation. And then our entire vaccination effort is open to the public to schedule in. It's limited only by the number of doses that we receive from DHS at this point.
So let's talk about what's currently coming in from the federal government to the state and then to you right now. What does your current allocations look like, and how do you expect that to increase?
You know, allocations have been relatively stable. We did get a shipment of Johnson & Johnson this last week, which we're able to use now. So, you know, gradually doses coming into the state increase. That results in small increases for us. But I think, you know, the approach is not that, you know, large vaccinators like UW Health will get a majority of the vaccine and give it. It's more of a distributed model whereby, you know, if UW Health doesn't have it, that doesn't mean nobody has it. It just means, you know, look around, try to find other vaccinators. They may have it, even though their ability to vaccinate might be a little bit lower. They may be outside of Dane County. So just because we don't have it on any given day doesn't mean someone else nearby or in another county doesn't have those doses available that you might be eligible to get.
Now let's talk about how many people you're able to vaccinate right now. So let's, for example, I don't know if you have the numbers on you right now, but how many have you been able to vaccinate this week? How do you see those numbers increasing over the next couple weeks?
You know, for the last several weeks, we've been vaccinating, you know, just north of 2,000 doses per week. We have the capacity to do about 7,000 doses per week. You know, and I think that's good news because as the state sees more vaccine, it's nice to know that vaccinators have capacity to move faster, to vaccinate people more quickly. And really the only rate limiting step is getting vaccine into our vaccination clinics.
What do you think the biggest challenge is going to be starting this Monday and in the coming weeks for yourself, for UW as a major vaccinator in Madison?
You know, I think the challenge for us is we anticipate having full schedules and we have operations that support full schedules. I think as we start getting more vaccine and we move up from that 2,000 doses per week to much higher levels, that could stress our system. But right now we have enough additional capacity where we anticipate being busy. We anticipate having all of our appointments full, but we should be able to keep up with that demand even as millions more people become eligible on Monday. I think the real challenge will be for individuals who want to get vaccinated. You know, the competition increases starting tomorrow.
SSM Health is another major vaccinator in South Central Wisconsin, and I'm joined next by their Vice President of Pharmacy Services, Mo Carbot.
Let's just start with how SSM Health is expanding to meet that demand.
Yeah, we're expanding our operations. We have several COVID vaccine clinics across our service area in Madison and in neighboring counties as well. And our goal is to expand our clinics by opening on days that some of the clinics were not open for the vaccine. Also, we will be extending our business hours. And also, we will increase our emphasis on mobile vaccine events to make sure that the vaccine reaches all demographics and populations in our community in light of the expanded eligibility criteria as of Monday.
And you have a lot of clinics in different areas to get vaccinated across Wisconsin. How many people are you vaccinating right now every week?
Well, for now, we're vaccinating, I would say about 6,000, roughly 6,000 individuals' first doses per week across our service areas. But that's because we're limited by the number of doses we get. If this allocation or if this quantity, for example, is to, I'm going to just make an assumption, is to, for example, double, then we will expand our operations to add the additional appointments across our service area, hopefully a few thousand appointments, new appointments, that is, hopefully next week to be able to meet the demand.
Thinking ahead ahead to Monday, do you have any final thoughts just as we open up eligibility? What would you add to what we've discussed already?
Well, a few things. First of all, I will encourage everyone to still wear your mask and social distance and practice infection control, practices to make sure that that we continue to keep the number of COVID cases down and low, and we hopefully won't see another surge in Wisconsin. So that's number one. Number two is to be patient and contact your healthcare providers first. Try to schedule a vaccine appointment through your healthcare provider. And if you can't, then you're welcome to contact SSM Health, contact other vaccinators. Also, here in town, Public Health of Madison and Dane County also will be having vaccine events that hopefully will be open to the public. Retail pharmacies, some of the retail pharmacies also have capacity and availability. So I'm going to ask everyone to be patient and to reach out to the different avenues to hopefully get a dose scheduled as soon as possible. If you can't get a dose right away and you get an appointment in 2 weeks, that's also that should be acceptable, and we should be patient for that, and wait for that appointment. Many of us waited 3-4 months. Waiting another week or two hopefully is not a problem.
I think that's an important message. We can all wait a little while longer. All right. Well, always a pleasure to talk to you. Thanks so much for joining me.
My pleasure.
After the break, public health officials weigh in on where they are at in the process.